Hi everyone, welcome to PHARMA Overview. Today's topic is dengue beware. Dengue fever is a mosquito-borne illness. It is a viral infection transmitted to humans through the bite of infected mosquitoes. How mosquito is causing infection? When a mosquito bites a person infected with a dengue virus enters the mosquito along with the blood. Then that mosquito bites another person. Virus enters that person's bloodstream and causes infection. The severe form of dengue fever is known as dengue hemorrhagic fever, and it is first recognized in 1950s during dengue epidemics in Philippines and Thailand. It occurs in tropical and subtropical areas of the world, mostly in urban and semi-urban areas. It's mostly seen in Southeast Asia, the Western Pacific Islands, Latin America, and Africa. Although an estimated 100 to 400 million infections occur each year, over 80% are generally mild and asymptomatic. Vectors of dengue fever. Vectors are the disease-carrying organism. Vectors of dengue fever are mosquitoes. There are two types of vectors, primary vectors and secondary vectors. Aedes aegypti is the main primary vector, and to a lesser extent Aedes albopictus is also the primary vector. Secondary vectors are Aedes polynesiensis and Aedes niveus. Aedes aegypti could breed in natural containers such as tree holes and also in man-made containers such as buckets, mud pots, discarded containers, used tires, stormwater drains, etc. It is a daytime feeder and its peak biting period are early in morning and evening before sunset. And about the life cycle of mosquito, female mosquito requires blood for egg production. Eggs laid onto the stagnant water surface and larvae hatch from the eggs in water. Then the larvae develops into pupae and then into adult mosquito. And about the infection cycles of dengue fever, uninfected mosquito bites a human infected with dengue virus. Then this mosquito ingests blood with dengue virus and then replicates. This infected mosquito again bites the non-infected human. Thus the virus circulates in the blood for 2 to 7 days. Dengue virus is the disease-causing organism. There are different types of dengue virus. Dengue virus 1, dengue virus 2, dengue virus 3 and dengue virus 4 serotypes. It is a member of genus Flavivirus in the family Flaviviridae. The structure of dengue virus is roughly spherical with a diameter of approximately 50 nanometer. The core of the virus is known as nucleocapsid, which is a structure made up of viral genome with C proteins. The nucleocapsid is surrounded by a membrane called viral envelope, which is a lipid bilayer that is taken from the host. And these transmembrane envelope protein and matrix proteins are embedded in the viral envelope. And about the transmission and pathogenesis of dengue fever, there are different modes of transmission. Mosquito to human transmission, human to mosquito transmission, maternal transmission, that is from pregnant mother to fetus, and other transmissions like blood organ transplantations or through blood transfusions or by the use of blood products. And about the pathogenesis of dengue, during the feeding of mosquitoes on humans, mosquito takes a blood meal and delivers dengue virus into the skin. Dengue virus then injected into the bloodstream through epidermis and dermis layers and activates mast cells, macrophages and dendritic cells. These infected cells then migrate from the site of infection to the lymph nodes, and then the infection is amplified and enter into the lymphatic system. Through the lymphatic system, these virus infected cells and circulating virions travel to the various organs and thus cause infection. And about the signs and symptoms of dengue fever, majority cases of the dengue fever are asymptomatic and mild. It usually begins 4 to 10 days after bitten by an infected mosquito, and symptoms last for 2 to 7 days. Dengue fever should be suspected when a high fever of 40 degrees Celsius or 104 degree Fahrenheit is accompanied by the following symptoms. In case of mild dengue, severe headache, pain behind the eyes, muscle and joint pain, nausea and vomiting, rashes may happen. In case of severe dengue, plasma leaking, fluid accumulation, respiratory distress, severe bleeding, organ impairment, liver enlargement, persistent vomiting, bleeding of gums and fatigue. Diagnosis of dengue fever. Patient sample collected in the first week of illness for diagnosis and should be tested through these methods. First method is virus isolation method through RT-PCR technique. Another method is serological method using ELISA, that is enzyme linked immunosorbent assay. Because of this infection, antibodies are developed inside the human body. These immunoglobulin M antibodies are detectable approximately 1 week after the infection and remain detectable for about 3 months. Dengue treatment. There is no specific treatment for dengue. In case of fever, take paracetamol or crocin. In case of headaches, muscle aches or joint pains, doctors will prescribe painkillers. If there is any severe bleeding, avoid pain relievers like ibuprofen and aspirin. Drink plenty of fluids and keep hydrated. The patient should take rest, stay hydrated and seek medical advice if necessary. And about the vaccine, dengue vaccine, the first dengue vaccine, dengue vaxia, developed by Sanofi Pasteur, was licensed in December 2015. It is a live attenuated dengue vaccine. As per the clinical trials, it is found to be efficacious and safe in persons who have had a previous dengue virus infection. Prevention of dengue. If you know you have a dengue, avoid getting further mosquito bites during the first week of illness. Virus may be circulating in the blood during this time, and therefore you may transmit the virus to uninfected mosquitoes who may in turn infect other people. Prevent the mosquito breeding by searching and destroy the mosquito breeding sites. Use personal household protection measures like window screens, mosquito repellents, coils and vaporizers. Also, dengue can be prevented by wearing protective clothing. That's about the details of dengue. If you like this video, please share and subscribe. Thank you for watching PHARMA Overview. Bye.